The core matter in that petition is about the access of Kenyatta University medical students to use this facility in their learning. So we've just made a visit to university just to familiarize ourselves with the facility itself, and also get submissions from the university and also from the hospital board and management. That is exactly what we have done, and as a committee, we cannot comment more than that until we conclude our report and make our submissions to the House. You want to throw me into a controversy. However, because this is a country that runs through legislation and legal notice, there is a legal cassette notice establishing this hospital as a parastatal. Asanteni sana, wacheni maneno mingi. Mimi najua hiyo nyingine ni fitina.
Yes, we petitioned as a student, and the content is huge. Number one is that we want the ownership of the hospital to be reverted to Kenyatta University, because that was the main aim for its construction. Number two is that we get access. Of course, when you get ownership, we will get the access of the hospital. You have seen the different wings that were basically petitioned for use by students. Yeah, so those are the two main aim of our petition: reverting the ownership of the hospital and getting access and use by students of the allocated premises.
Kile ambacho tulipeleka Senate ni petition ya kwamba tunataka wanafunzi ambao wanasomea medicine Kenyatta University waweze kutumia hospitali hii ya Kenyatta University Teaching, Research and Referral Hospital, kwa sababu imekuwa safari ndefu sana tangu Mei, wakati ambapo tulianza kupeleka hii petition na tukaenda mwendo huo, na tunashukuru sana committee ya health ambayo inaongozwa na Mheshimiwa Jackson Mandago kwa kutusikiza sisi kama wanafunzi, na kwa kweli tumeona kuna light at the end of the tunnel, kwa sababu leo kumefanywa ile inspection na tumefurahi sana kama wanafunzi, wasimamizi wa wanafunzi. Ndio kuna wanafunzi ambao tumekuwa tukisikia hapa na pale kwamba wanatumia hospitali hii, ilhali kuna wanafunzi wa Kenyatta University ambao hawajaweza kukanyaga hapa tangu hospitali hii ianze. Yeah, ni kitu ambacho kinatusikitisha sana kama wasimamizi wa wanafunzi, na ndiposa tulienda pale katika Senate kuomba usaidizi, kwa maana sisi wanafunzi wametuwekea pressure sana, na sio wanafunzi peke yake, pia wazazi wanatuuliza mbona mko na state of the art facility lakini wanafunzi wenyu wa medicine hawawezi wakatumia facility hii.
It is true the students have delayed coming because we signed the MOU in 2020. Our understanding as a board, the hospital board, is that once we signed the MOU in 2020, the university, as per the policy, would then write to the regulator, that is the Kenya Medical Board, and the Nursing Council. Write to them, ask them to come and evaluate us because they want us to be their training institution. So that is the policy, in the current policy, that the training institution, the owner of the students, write to the board asking for the training institution that they want to be evaluated. So that was never done. And I think I said this a few months ago, that I was worried that the university is not asking the board as per policy, and they should attach the MOU, which we signed in 2020. So we've been writing. Actually, I was able to show the Senate several letters we have written to the university, reminding them that they must write to the board for the students to come. Otherwise, if the students come without the board, they will not be recognized by the board, because the students, doctors belong to the board. And even the board itself cannot even register them if they come without their permission. But luckily, and the good news, and the Kenyans should know that our Minister for Health was able to intervene, and she looked at the issue, and she actually instructed the board to now come and evaluate us without KU asking. So she instructed the nursing board, she instructed the medical board, and the nursing council came 2 weeks ago. They evaluated us. I think the report is out, but the preliminary report shows that they have given us the go-ahead to admit nursing students. The medical board came last week, They evaluated us, and that report is out. We have the report, and they have allowed us to take medical students. I think they have allowed us to take 100, and also they have specified the areas where we can take them, because we can't take them in all the areas because we are still a young a young hospital. So the good news is that with the minister's intervention, our Minister for Health, that has happened. And now the students can come anytime. As soon as KU is ready with the students, they can come. Everybody has been so tired about this issue. We assume that now that we are accredited and the students can come, the issue will be behind us. But who knows? I mean, the university still wants the hospital to belong to the university. They want the legal framework to change so that they are allowed to manage the hospital. So maybe those issues will come. But I think the government is clear on where the direction that they want to take in terms of this hospital being a level 6 hospital. I personally, as a Kenyan, support the government in that, because it is difficult for a university to also run a level 6 hospital. I've been here as a chair, and I can tell you it's a lot of organization, it's a lot of work, it's a lot of details. And even me, and I think somebody asked me that whether if I was the VC, I would still be having the same position. And I said, even if I was the VC KU today, I still would have the same position, that a university cannot also run a hospital, especially level 6 hospital. They can run health centers like KU is running and other institutions, but a level 6 hospital cannot be run by a university. However, that does not mean that the two institutions can't work together in terms of training, in terms of research, and in terms of other capacity building efforts. That's another good question, because I think that's the impression that has been created out there. But I would like to say that Professor Wainaina was my deputy for 5 years. I have no issue with him. He worked as per his mandate, and that time we had no problem others Kenyans would have had. I think the problem started coming now when the hospital became a parastatal. I was made the chair, through the wisdom of the president, because these are presidential appointment, and I think that did not go down well with President Naina, because I can't think of anything else between us except that, and otherwise he would not have worked together all those years. So just to clarify, there's nothing between me and Professor. And you see, once the students start coming, I am hoping the issues will be behind us, especially because the issue of ownership has been resolved by the government. The issue of training has been resolved by Madam CS of Health. So really there's nothing else that will come in between us. We are welcoming, we are looking forward for the students coming. And let me also add that another part of our working relationship with KU is research. We are even looking forward to working with our lecturers there to do research. Some of them are already doing research here. And also we are looking forward to maybe do other things like innovation with them. We have no problem at all. We are all scholars, we are all public servants, and I think now that the issues have been resolved, especially student training, now that in her wisdom, our minister has dealt with the problem. So we are happy. However, there's one area that we have requested the government to help. And I'm happy to say again that the government is looking into it, and that is the area of radiotherapy. Radiotherapy is a machine that treats cancer, just like chemotherapy. Some doctors will order chemotherapy, others will order radiotherapy. Now the radiotherapy machine, we have one. It is very, very, very busy. We are seeing 115 patients in one day being treated through radiotherapy. And the reason why we do this, and this is done through 3 shifts, there's even a night shift, is so that to reduce the queue, because there's so many people waiting to be treated. So the area we have requested government, and the government has listened, and I think they are doing something about it, is buying a second machine. Because if the machine we have now broke down today, I don't know what would happen to those patients. But even with that one, we still need a second one, because the queue is like 2 or 3 months for radiotherapy. And these are sick people. They need to be treated. So second machine, the second LINAC machine, we already, explained to the ministry, and also, in terms of the need, and I think they are doing something about it. So that is one key. And the other one is, I think I talked about it earlier, is a machine we call next generation sequencing machine. This machine, again, is very important because it's able to analyze cancer and the genetic makeup of that cancer, so that when I'm given medicine, as Professor Mugenda, God forbid, I'm given medicine for the cancer that matches my genetic makeup as opposed to another person. That way, the outcomes are better, and the medicine or the treatment is more precise and is more effective. We don't have that machine here, so that I think we are missing out as a country. We are able to explain this to the government. They see the gap, and they are doing something about it also.